everyone. There's one important fact that many people only discover when it's already too late. The jawbone has been slowly deteriorating for years without them even noticing. Many patients come to the dentist thinking, I only lost one tooth. I can still chew normally. It probably doesn't need treatment yet. But when we take a 3D convex CT scan, we often discover that the bone in the missing tooth area has already shrunk significantly. In some cases, the bone loss becomes so severe that the sinus drops lower or the nerve canal becomes too close, making future implant treatment far more complicated, time-consuming, and expensive. The concerning part is that jawbone loss happens silently. It doesn't cause sharp pain like a cavity. It doesn't swell dramatically like an abscess. Because of that, many patients ignore it. In today's video, I would like to share with you 5 common warning signs that may indicate the jawbone is gradually shrinking, even if you don't realize it yet. The good news is that when detected early, bone loss can often be managed and prevented from becoming much more serious later on. Sign number 1. Nearby teeth begin tilting or shifting. This is one of the most common signs after losing a tooth. Many people think it's only one missing tooth, it won't affect anything. But in reality, every tooth in your mouth functions like part of a connected system. Each tooth supports and stabilizes the others. When one tooth is lost, the jawbone underneath no longer receives chewing stimulation. Biologically, the body interprets this as an area that is no longer needed, so the bone gradually begins to shrink. At the same time, the neighboring teeth slowly start drifting toward the empty space. At first, the movement may be minimal, but after several years, patients often notice food getting trapped more easily, difficulty cleaning between teeth, changes in their bite, teeth becoming uneven. I've seen many patients who lost a molar 5 to 7 years ago. By the time they came in for consultation, the adjacent tooth has tilted so severely that it nearly collapsed into the empty space. At that point, we not only have to deal with the bone loss, but also correct the tooth position before placing an implant. That significantly increased treatment complexity and treatment time. So if your teeth are gradually shifting after tooth loss, it's not simply teeth moving naturally. It may also be a sign that the jawbone underneath is shrinking. Sign number 2. The gum area starts looking sunken. This is another very common clinical sign. Healthy gums normally appear full and well supported because there is strong bone underneath. But when the bone gradually disappears, the gum tissue above it also collapses and shrinks. Many patients notice a hollow or shrunken area where the tooth used to be a slightly sunken cheek, facial asymmetry, uneven gum appearance when smiling. This is especially noticeable in the front teeth area, where bone loss can significantly facial aesthetic. This is one reason why dental implants are highly recommended today. Beyond replacing the missing tooth root, implants have maintained stimulation to the jawbone, which can slow down and prevent further bone loss. Sign number 3. Dentures become loose over time. This is a very typical sign in patients wearing removable denture for many years. At first, the dentures may fit well. Over time, patients begin noticing denture slipping while speaking, the need for denture adhesive, pain or soreness while chewing, frequent adjustment that no longer help. Many people assume the denture is just old, but the deeper issue is often continuous jawbone loss underneath. Let's think of it this way. A denture is made to fit the shape of the jawbone at a specific point in time. But if the bone changes over the years, the denture no longer fits properly. Some elderly patients need repeated dental adjustment every few years simply because the jawbone is shrinking too quickly. tooth loss, bone loss, loose denture, poor chewing, faster bone loss, and this creates a vicious cycle. Today, in many situations, implants can be combined with dentures to provide much stronger support, improving chewing ability and overall quality of life significantly. Sign number 4, difficulty chewing even without tooth pain. This is a sign many people overlook. Patients often say, I don't feel pain, but chewing doesn't feel as strong as before. When the jawbone shrinks, the support system of your teeth becomes weaker. As a result, the entire chewing function gradually changes. At first, many patients may unconsciously avoid chewing on one side. Later, they notice difficulty eating hard foods, jaw flatties while chewing, weaker biting force. Food becomes less enjoyable. Some people slowly switch to the softer foods for years without realizing why. This is particularly concerning in older adults because long-term chewing difficulties can affect this digestion, nutrition, and overall health. In fact, many modern studies have shown that tooth loss and reduced chewing function are closely associated with quality of life, nutritional health, and even systemic health in elderly patients. That's why waiting until pain appears can be dangerous. Jawbone loss often progresses quietly long before major symptoms develop. Sign number 5, your face starts aging faster. This is something many patients notice one after comparing old photographs of themselves. Long-term tooth loss and jawbone deterioration can cause hollow cheeks, lips collapsing inward, deeper wrinkles around the mouth, a more protruding chin appearance, shortening the lower facial height. Simply put, the structural part of the face gradually disappears. I've seen patients in their 40s whose facial appearance looks significantly older because of long-standing tooth loss. After proper implant rehabilitation and by restoration, many patients experience visible improvement. Fuller cheeks, improved facial balance, better lip support, a more youthful overall appearance. This is not cosmetic surgery, it's a restoration of the natural support system that was lost over time. So why is jawbone loss so dangerous if left untreated? The biggest problem with jawbone loss is this. The longer you wait, the more complicated treatment becomes. In the early stage, when sufficient bone remains, treatment is usually much simpler and more predictable. But when the severe bone loss occurs, the patient may require bone grafting or sinus lift procedures or longer treatment time and higher treatment costs and more complex surgical planning. That's why dentists strongly recommend early evaluation after tooth loss instead of waiting until symptoms become severe. Today, with technologies such as 3D contour CT scan, digital scanning, and advanced bone analysis software, dentists can evaluate bone conditions very accurately and create highly personalized treatment plans. Modern dentistry is no longer just about treatment complications after they happen. It's about detecting problems early and preserving as much as natural structure as possible. So if you're experiencing any of the signs discussed today, long-term missing teeth, sunken gum, shifting teeth, reduced chewing strength, loose dentures, please don't assume it's simply part of aging. Your jawbone may be slowly shrinking without you realizing it. Getting evaluated early does not necessarily mean you need immediate treatment, but it allows you to fully understand your condition and make informed decisions before treatment becomes much more difficult later on. I hope today's video has helped you better understand jawbone loss, a silent condition that can significantly affect oral health, chewing function, and facial appearance over time. Thank you very much for watching. If you found this video helpful, please consider sharing it with friends or family members, especially those who have been missing teeth for many years but have never had their jawbone checked.